ADHD, much like most mental health disorders, is genetically based. So we think about imbalances in certain brain chemicals called neurotransmitters, in particular norepinephrine and dopamine. ADHD is treated with medications very effectively, and the medications target these very same neurotransmitters or brain chemicals. There are other types of treatments for ADHD, like sort of learning executive planning skills a little bit better, and sometimes that's enough. There are other times where it's really important to regulate that biochemical imbalance with medications. So there are two main classes of medications for ADHD. One would be the stimulants, and we refer to the methylphenidates and the amphetamine derivatives as stimulants. These are medications that work on the dopamine and norepinephrine imbalance in the brain. There are other medications that we refer to as non-stimulants, and those medications work on other neurotransmitters in a different way that can kind of help with the dysregulation of the biochemical balance. Patients that are starting medications for ADHD want to know what the side effects are going to be. That's one of the most common questions. And some of the side effects that can happen with these medications involve a decrease in appetite, involve difficulty sleeping if the medications are taken too late in the day, and involve a little bit of an increase in anxiety in some people, but we can avoid that by making sure we have the right dose and the right medication. What's really great about many of the medications for ADHD is they can work almost immediately. As in almost the first day that you take the medications. You'll notice that you're more efficient, that you're more able to focus and get that task done that used to take you 3 hours. You might be able to get done in 1 hour. And you'll notice a really significant change. So once you start taking medications for ADHD, it doesn't necessarily mean you're going to be on them forever. Once you start these medications, you realize, I'm capable of doing this task in less amount of time, and you sort of get used to or have this new habit of how you get that task done. It might be easier another time later on to do that very same task even without the medication, because you've actually experienced that more efficient way of getting it done.